It is my great pleasure to introduce Mercedes Mayol Lassalle, World OMEP President. This is the World Organization for Early Childhood Education, Professor of University of Buenos Aires from Argentina. Good afternoon, Ms. Lassalle.
Good afternoon, good morning for me. I am living in Argentina. It's very early here. Well, I'm very happy with the invitation, and I want to share with you some ideas about the challenges of the realization of the SDG 4 in relation to early childhood education and care. Well, the struggle for human rights and the recognition of early childhood citizenship has a long story, and its development is revealed since the beginning of the 20th century in different international declarations and treaties, such as the 1923 Geneva Declaration, endorsed by the Fifth Assembly of the League of Nations, the first version of the Declaration of the Rights of the Child in 1948 that was expanded in 1959, both by the United Nations, approved by the United Nations General Assembly. Finally, the closing stage was the Convention of the Rights of the Child, approved in November 1989, that in a few years was adopted by most of the countries all over the world. These legal frameworks were possible because of the action of multiple human rights activists and NGOs that work together with governments in the UN system and in its organizations like UNESCO, UNICEF, WHO, and others. OMEP was created in 1948 during the first Congress of UNESCO. The founders of this international non-governmental and non-profit organization were a group of humanists who understood that early childhood should receive a special attention facing the consequences of World War II. Early childhood was recognized as a core stage of the development of every human being and requires special attention and efforts in order to assure survival and well-being for all children. OMEP, that is currently in over 70 countries, has been working connected with the United Nations system with consultative status, and nowadays we have special consultative status. OMEP members have always believed that this is essential to cultivate solidarity and relationships with the United Nations system, understanding that multilateralism is a method, a principle, a procedure to safeguard humanity conquest and advances and to face challenges in an uncertain future. Civil society organizations must be involved into the achievements of the dreams of humanity and to contribute to the development of new knowledge, plural perspectives, while raising invisible, hidden, and marginalized voices behind other more powerful. The United Nations has made enormous efforts to build a fairer and more balanced international order. And under its leaves, rights and duties has been established with a vocation of national and international validity. This action must be supported, protected, and enlightened with constructive criticism. That is why OMEP is joining this 75th anniversary of the United Nations that we have accompanied for 72 years. OMEP has been always endeavoring to bring early childhood to the global center of the attention and promoting the right of education and care, because we believe that education is not only a right, it is a tool for the realization of other rights, and today is the catalysator of the Sustainable Development Goals. Government and worldwide organizations have reached out for our members' advice about child-related policies, laws, action plans, research, and education programs. One of the most relevant contributions was our participation in the drafting committee of the Convention of the Rights of the Child. Nowadays, we have been chair the NGO Committee on Migration during the last 4 years in the UN, and we have been working with UNESCO in the decade of education for sustainable development. Its overall aim is to enhance the awareness of the importance among other members, colleagues, teachers, schools, and young children. For that reason, we have been running ESD projects during the past 12 years, reaching more than 50,000 children and 20,000 adults on more than 70 countries. OMEP members were also actively engaged in the definition of the Education 2030 agenda, connected with the Sustainable Development Goal 4.2. But also, we are involved in the achievement of the Sustainable Development Goal 4.7, related to the promotion of sustainable development, human rights, gender equality, cultures of peace, and global citizenship. Nowadays, our work focuses on the realization of this ambitious agenda, contributing, monitoring, and following the achievements of governments on public policies and educational practices. Through our action, we have developed capacity to reach out to members and partners across the world, mobilizing for the right for universal access to quality education and care, from birth to age. Through campaigns, advocacy, networking, research, and resource mobilization, members were able to build a movement aimed to policy change at national and international level in the protection and promotion of human rights. When we talk about childhood, we are facing with a reality of multiple ways of living this stage, of experiencing childhood. Together with the most privileged children, there are other children growing in poverty, violence, migration, displacement, imprisons, those suffering affected by climate change, environmental degradation, racism, xenophobia, gender discrimination, sexual or labor exploitation. These are the challenges we must to face every day. All over the world, children are suffering and claiming for justice. In order to change this reality, since 2015, humanity is committed with the achievement of the Sustainable Development Goals. States are obliged to respect and promote this agenda that is crossed with the legal framework of human rights. Young children are human right holders. They are citizens, and their human rights are universal, indivisible, and interdependent, and must be guaranteed by the state. The realization of children's rights in early childhood is not limited by their evolution of faculties. This process is positive and enabling, and not an excuse for authoritarian practices that restrict the child's autonomy and expression. As I had said, education is a fundamental right of every person and the basis for the realization of other rights. But that reason, it is not possible to care about without educating, nor educating without caring. The big aim of the 2030 Agenda is to ensure inclusive and equitable quality education and promote lifelong learning opportunities for all. Inclusive education is a process that helps overcome obstacles that limit student present participation and achievement. Inclusive education systems remove the barriers limiting the participation and achievements of all learners, respecting their needs, abilities, and characteristics, and eliminating all forms of discrimination in learning environment. But we know that access to early childhood education and care has grown, but it is still very limited, mainly during the first 3 or 4 years of life. What are the obstacles to inclusion in early childhood education? Even OMEP is working over 5 regions. Today, I want to share with you the experience of OMEP work in Latin America and the Caribbean. Are these countries achieving inclusive, equitable, and quality education for children in early childhood? How is the pandemic affecting the responses to assure early childhood education and care? According to a recent study we developed, there are 3 main problems: huge inequalities, fragmentation, and diversity. What are the obstacles in the legal framework? Well, not many. Most of the general education laws in Latin America and the Caribbean are supported on the guidance of the CRC. Early childhood education is recognized as human rights, but the age of free and compulsory education has variations between countries where the beginning of age 4 predominates. Education laws coexist with other laws, and this results in fragmentations, dispersion, and sometimes contradictions in perspective, governance, and policies. Another problems are the budgets. Few
Nicolás.
education laws
Ay, Nicolás.
include...
Muy bien.
Another problem are budgets. Few education laws include clear financing strategies and fair distribution. Therefore, early childhood education and care budgets are more vulnerable and have less priority than the ones for other educational levels. What are the obstacles in public policies? Well, most of the public policies are fragmented. The principle of comprehensiveness proposed by the CRC is not addressed because intersectoriality is not accomplished. Different government sectors are leading diverse projects based on different approaches and principles, focusing their attention in different age groups and with their own criteria on managing budgets. There is also fragmentation by age in ECCE policies. Children aged 4 to 8 and mainly under the responsibility of the educational sector, while children from birth to 3 are cared by social protection and their rights are not protected by the governmental policies. This situation emphasizes inequalities and leads to a profound gap in the provision of quality service and the fulfillment of rights. Another factor is the privatization of early childhood education and care offer. The lack of clear action and investment of state has determined the development of a communitarian initiatives and the expansion of for-profit programs. This results in a stratification and rising inequalities in access to quality education based on the economic conditions of each family. While free offer is linked to compulsory education, access for children from birth to the age 3 still depends on the economic possibility of the families who can afford it. This shows that for many children and many families, early childhood education and care remains in practice as a privilege rather than a human right. The availability of facilities continues to be a qualitative and quantitative challenge, especially for the age group from birth to 3. There are no rules for safety condition and construction requirements, monitoring and inspection system for those run by the private sector. Quality of early childhood education varies according for different perspectives. Some institutions focus only ensuring the most basic care and survival. Others apply methods from primary education and focus in academic learning, achievement, and assessments. This is why we are trying to show the importance of the principles of educare, the best interest for the child, and the recognition of the evolution of the capacities of children that are proposed for by the CRC. Another factor linked with quality are educators. The fragmentation and the diversity of education, institutional policies and format defines different certifications requirements depending on the government sector and the age group they serve. Those over the age of 4 tend to have better qualified and paid teachers. Likewise, the feminization of the teaching profession is another characteristic in Latin America and the Caribbean related to gender stereotypes. Finally, there are inadequate ratios, that is to say, that is a lack of clear regulation to determine the maximum number of children assigned to each educator to guarantee bonds and personalized education. What would be the qualities of public policies aimed at guaranteeing the right to inclusive and quality education? We propose to consider some essential principles: universality, progressiveness, comprehensive approach, variety of programmatic and institution formats, quality in system practice and practice in education, educare approach, multi and intersectorality, and sustainable financing. On this ground, the pandemic of COVID-19 appeared around the world during the first months of 2020, highlighting structural inequalities, injustice, and weakness of the public policy of and states regarding early childhood education and care. We still owe a great debt to early childhood, making the situation worse. When the COVID-19 pandemic began, state make quick decisions to protect human lives, and health measures that in general did not consider primarily well-being and education for young children. In most of the countries, guidelines did not take early childhood citizenship into account, nor their special needs or rights. States adopted an ethnocentric matrix and a health perspective centered on adults. For this reason, advocated for the visibility of the right of the child, of the rights of children, and among other actions, presenting a position paper on early childhood education and care in time of COVID-19, calling the state to action in favor to the youngest. We stressed that public policies must include the consideration of children's perspectives in all matters that affect them. Their ideas, emotions, interests, and needs must be taken into account in the framework of public policies and measures developed during the pandemic, overcoming traditional views focused on adults. Assume that the opening and operation of early childhood education and care centers cannot depend merely on a vision focused on health or in response to economic interest. Decisions should consider the experience and the knowledge of educators and families, as well as other related actors. Build a comprehensive solutions with intersectoral articulations to accompany and support families, protecting children's right to health, food security, recreation, play, vital for their growth and development, and preventing and intervening in situations of domestic violence and abuse that has increased a lot in the region. Provide a comprehensive protection of the rights, addressing special measures for the most vulnerable groups. Guide and train educators on distance education strategies and communication with families and children, both during the closing of the centers as well as in the implementation of new protocols, new approaches to reopen institutions. Guarantee young children their right to health, giving continuity to regular checkup, vaccinations, timely care, especially for children with disabilities, and implementing prevention and promotion strategies for health-based education. And consider the importance of a good use of available technologies through creative proposals, strategies, and materials, taking into account that young children should not be exposed to screens during long hours. On the other hand, we have to admit the deep inequalities to access of technology devices and to internet connections. How to build a new reality for early childhood. OMEP has been working in connection with the UN system for many years, 72 years. In the Latin American and the Caribbean region, in the last 7 years, we have participated in all the meetings with the ministries of education organized by UNESCO, having the possibility to orient strategies and to advocate in favor of young children. We are also participating in the regional training program in education policy planning and management of the International Institute of Education Planning of UNESCO, and tutoring official and governments and other stakeholders on the region for the development of public policies of early childhood education and care. In the global arena, I am an elected member of the coordination group of the collective consultation of our NGO on Education 2030 in UNESCO, and our representatives are taking part in the inclusive, innovative dialogue towards global partnership strategy, reinforcing collaboration and working together on a global strategy for early childhood education and care. The COVID-19 crisis has shown how connected we are worldwide. We cannot continue supporting this civilizing model, which has led us to an unprecedented human, social, educational, economic, and environmental global crisis. This is not a pandemic, this is a syndemic, a group of pandemics altogether. We must focus our responsibility on the present and the future lives of our children. And this requires rebuilding the society we want. There is a possibility of creating a better world for our children, but it needs solidarity and collective efforts based in the lessons of this crisis. Children need a state. Children need a family. Children need a civil society determined to promote a holistic and humanistic education and to protect their dignity and their rights. No public policies can be achieved without strong financing, and nowadays a challenge will be to determine priorities in the difficult economic situation for all the states. In the General Comment 19, the Committee on the Rights of the Child affirmed that in relation with the principle of the best interest of the child, state parties are obliged to integrate and apply this principle, including budgets. The best interest of the child should be a primary consideration throughout every phase of the budgetary process and in all budgetary decisions that affect children. OMEP sustained that children need a state, a family, and a civil society committed to protecting their dignity and human rights. Because of that, we are committed achieving the Sustainable Development Goal 4, persuaded that education is a right, but a tool to build a better world, leaving no child behind. Thank you.
Dear Mercedes, thank you so much for your great report, but let me speak Russian and leave translation for our interpreters. Уважаемая Мерседес, огромное вам спасибо за прекрасный доклад.
Thank you, Mercedes. Thank you for your report. We know a lot about the Russian committee, and I think that our Russian doll that you can see behind me